So it's Carly Ruddy, and I'm here at the office of Alberta Health Advocates, and we're going to interview Carol Robertson Baker and Deborah Prowse. A little bit about them before we see them. Carol Robertson Baker is Alberta's 5th mental health patient advocate. She has over 30 years of experience in the addictions and mental health fields, and previously managed an outpatient treatment and prevention clinic in Drayton Valley for the former Alberta Alcohol and Drug Abuse Commission. Earlier in her career, she worked with children and youth as a child care counselor and has also worked with adults with developmental disabilities as a life coach. Deborah Prowse has professional background and training in social work and law. She has worked as a social worker, lawyer, mediator, and workplace consultant. She was a commissioner in the office of the Chief Commissioner of the Alberta Human Rights Commission and sat as a sitting justice of the peace in traffic court. She has recently taken the position as Alberta Health Advocate and Interim Senior Advocate. Can you tell us a bit about the history of how the Office of Health Advocates came to be?
Thanks, Carly. The Office of the Alberta Health Advocate was opened in April 2014. The mental health patient advocate position has actually existed in Alberta and has a great reputation. This position has been in Alberta for 25 years. So the health advocate and the seniors advocate were added to the good work that the mental health patient advocate has been doing. We all came together April 1st, 2014. It creates one office for Albertans to call when they have concerns about their healthcare experience.
So Carol, now that we have a bit of the history behind the Office of Alberta Health Advocates, can you tell us what it is that you do?
So Albertans call us to tell us about their personal stories and experiences with the healthcare system. For some of them, they find it very complex and confusing. So we assist by helping them navigate the system. We give them information about mental health, about health, as well as seniors programs and services that are available across the province. We also give them information about the Mental Health Act, rights under it, as well as information about the Health Charter. One thing that is very important to us is that there's a focus on patient and family-centered care, whereby patients and family members are treated with dignity and respect, that there is a partnership between the patients, the families, as well as the caregivers, and that patients and families are given the information that they need to make informed decisions. So we certainly promote and foster that. Another aspect of what we do is provide education services to different organizations and patient and family groups. And we also hear, as Deb mentioned, of some of the concerns, some of the things that didn't work so well in the health system. So when we get complaints from some of the callers, we determine exactly what the issue is and what their desired outcome is. And based on the nature of the complaint, we decide whether or not it's something for us to investigate or if it's better to refer them to another organization that resolves concerns or an oversight body.
All right, Deb, so we know that there are 3 different areas. There's the mental health patient advocate, the health advocate, and the seniors advocate. I know that you're doing the interim seniors at the moment, but can you speak a bit about what the health advocate does first?
I can, thank you. The Alberta Health Act created the Health Charter, and it's a first of its kind in Canada, and it sets out the expectations between Albertans, providers, and organizations in their healthcare experience. So the role of the advocate is to educate and create awareness around the Charter, to assist individuals who have concerns or complaints about their experience, and to match them up with the best place to go with those concerns, to help navigate health-related programs. The healthcare system is very complex, and it's hard to find where you should be going to get assistance. So we help people with that. The health advocate also has the ability to investigate or review complaints that aren't under the jurisdiction of any other body. And we report to the minister on an ongoing basis, but also through our annual report. and provide him with insights of what we're hearing, trends and patterns, and how we've been able to resolve things.
And can you speak a bit about what the Seniors Advocate branch does?
The Seniors Advocate actually reports to the Ministers of Seniors, and this position was created to assist seniors, their families, and caregivers with questions that they have as they become seniors or issues that seniors might specifically face. Also assisting them in finding bodies where they can safely raise concerns and get those concerns dealt with. We also will do public education. I've been out speaking to numerous groups around seniors issues. We provide navigation and referral services to a number of programs and services, both run by the government and external to the government, to make sure that people get their needs met. We collaborate and engage with seniors to find out what are the issues that are most pressing on them. And the Seniors Advocate will also report to the Minister through an annual report with the Health Advocate or from our office, and provide ongoing advice as well on what we're hearing are the main issues.
Okay, Carol, can you tell us about your role as the mental health patient advocate and what it is that you do?
Sure. So as Deb mentioned, the mental health patient advocate has been around since 1990, and it's legislated under the Mental Health Act to help patients who are subject to one or two Form 1 admission certificates or Form 2 renewal certificates, as well as those who are under a community treatment order and those acting on their behalf. So a big part of what we do is provide information on the rights that are enshrined under the Mental Health Act. Some of the rights include being notified of the formal status once the patient's under 2 admission or 2 renewal certificates. It also includes being notified when the person is subject to a community treatment order. Another basic right is the right to apply to an independent body called the Review Panel to request cancellation of the certificates or the community treatment order. We also provide information about the rights that any decision made by the Review Panel can be appealed to the Court of Queen's Bench. People subject to the Mental Health Act also have the right to access a lawyer, as well as to access our office to assist them. So aside from the rights under our legislated mandate, we have the authority to investigate complaints for individuals who fall under our jurisdiction. Some of the complaints range from allegations of illegal detention to concerns about medication and the side effects of it, to privileges, to health and safety concerns, maybe concerns about the quality or quantity of the food that they're receiving in the hospital. Or it could be even basic respect and dignity, and from the patient's perspective, maybe the attitude that members of the treatment team might have, or from their perspective, perhaps some communication issues where they feel they're not involved in decisions that impact their life. So with our investigations, we always ensure that the correct issue is identified, and when we investigate, it could mean contacting various members of the interdisciplinary team. It could include getting a copy of the patient health record, copies of pertinent policies and procedures, and it could also include reviewing the legislation to see if indeed there was compliance with the legislation that's applicable to the issue. Once we complete our review of all of the evidence, we decide whether or not the complaint is founded, whether or not we found evidence to support the complaint. In those cases where we do find the evidence, we'll make recommendations that go to the appropriate party. So it could be a recommendation that goes to the nurse, the social worker, perhaps the dietitian, manager, or physician. When we do a more in-depth investigation that we call formal investigations, The recommendations go to the board of the facility, and in the case of individuals subject to a community treatment order, the recommendation goes to the issuing psychiatrist. Similar to Deb as the health advocate, the mental health patient advocate also completes an annual report that goes to the Minister of Health and is tabled in the legislature.
So Carol, now that we know the role that each advocate plays, can you walk us through a typical day or a scenario?
Okay. As Deb mentioned earlier, we are a provincial office and we're based in Edmonton. So folks usually contact us by telephone, but they could also send us emails or letters. Since we opened April 1st of 2014, we've opened well over 2,500 case files. So our frontline workers, who are called patient rights advocates or health advocate representatives, are very, very busy. They, in a typical day, might take anywhere between 10 and 30 or 40 calls. Once they receive that call, they truly try to identify what the issue or request is and what the person would like to see as a result of contacting our office, what their desired outcome is. They develop an action plan with the individual to ensure that they're comfortable with our protocol and process. In cases where our advocates feel that the person who's calling can advocate for themselves, our frontline staff will mentor them, coach them, make suggestions or give them options as to how they could deal with the issue. But of course, for those callers who just want somebody to advocate on their behalf, that is what we do. So in those cases, the advocates will contact various parties to get their perspective of the issue and request, and they'll review different files, documents such as the policies, procedures, the legislation. And what is key to their role is that they work with the client, keeping them informed throughout the process of what's happening until the final resolution of that particular issue. With the staff that we have, they are very, very compassionate. They love the work that they do. They truly are advocates in that they want the individual to share their story and their experience. For some individuals, they might come across as very angry with the health system. So our advocates help diffuse some of that anger through spending the time that needs to occur to help the client resolve some of the matters. The advocates are also trained and skilled in dealing with crisis intervention. I'm sure you can appreciate some of the callers may express intent to harm themselves and or to others, so we certainly take action, swift action in those situations. But I think for Deb and I, we certainly couldn't do our job without the support of these excellent staff that we have.
It sounds like every day would be kind of different as well, which keeps it interesting.
Different calls, yes, and for the advocates, they also help us going out into the community, visiting with patients, with families, attending meetings here when people come to talk with us and share their story. They go out and do presentations, some committee work. So it's a busy day for them, definitely.
Great. And so Deb, for our viewers watching, how can they get a hold of you for more information?
Our website is still being developed, but there is a placeholder website right now at www.albertahealthadvocates.ca. Email address is info@mhpa.ca, and telephone number is 780-422-1812, and it's accessible on the Right Government line as well. So if somebody's outside of the Edmonton area, they can call us toll-free using that number.
So Carol and Deb, thank you so much for your time this morning. We really appreciate it, and we look forward to staying connected.
Thank you.